to accomplish our objective. We slowed the spread, we flattened the curve, we saved lives. And then during the outbreak across the Sun Belt this summer, when we saw positivity rise to nearly 10%, the American people, officials at the federal and state level stepped up again. And we put that outbreak in the past. And even as we see help on the way, vaccines being developed at a historic pace, as I mentioned before, as we gather today, we are seeing cases and positivity rising across the country. But we approach this moment with the confidence of experience. We know the American people know what to do. We have forged a partnership that is truly seamless with state and local health authorities. And as we'll describe to you today, we've continued to work 7 days a week, all throughout this year and up to this very moment, to make sure the American people have access to the health care that we'd want any member of our family to have as we meet this pandemic. Now, cases are rising throughout the country. Positivity in the last 30 days has risen from an average of 5% to 10%. And to that end, we've continued the mobilization that began at President Trump's direction early this year. We increased testing from a standing start in the month of February to now, as of today, we've completed more than 170 million tests. And we continue to approve new tests, including an at-home test that the FDA just recently approved. And we're distributing more than 150 million Binax tests to schools and nursing homes around America as we speak. Our mobilization of supplies, you will hear described in great detail, continues to surge each and every day. We actually are able to track PPE and supplies on a hospital-by-hospital basis. And so we're carefully monitoring, we're working with state officials, with hospitals.
Those agencies for an effective transition. The president-elect was very careful in choosing his words, but I'm not going to be careful in choosing mine.
An exercise of what they would do if there was a pandemic that hit from Asia. So this is real learning that can help us.
Thank you, Mr. Speaker. Mr. Speaker, I support the three amendments.
More than 70% since those heartbreaking days of April. In May of this year, of course, as the President spoke last week in the Rose Garden, we launched Operation Warp Speed, focusing on accelerating the development, the manufacture, and the distribution of a safe and effective vaccine. And you'll have an update today on the progress from two of our leading experts and those that are coordinating Operation Warp Speed. What I want to say in the midst of all of this to the American people as we begin this briefing is that with the massive increase in testing over the last 10 months, with PPE and medical supplies and equipment that are available to the American people, with the medicines and the therapeutics, and very soon the vaccines that are available, America has never been more prepared to combat this virus than we are today. But our pledge to each and every American looking on today is we're going to work around the clock to keep it that way. We're going to make sure that hospitals that are seeing patients coming in on an increasing basis know that we're going to work around the clock to meet that need. And you have our continuing pledge and the practice of experience that we've had along the way. So in a few moments, you'll hear from members of our team. We're going to begin with Dr. Deborah Birx, who's going to describe what we're seeing in the rising cases. Literally every day for members of the task force begins with detailed analysis of what's happening across the country, and she'll give you our very best information on rising cases and hospitalizations. That information is summarized each and every week for the nation's governors and provided to them in particular detail as well. After Dr. Birx speaks, we've asked General David Sanford with FEMA to provide an update on our ongoing efforts to provide PPE and medical supplies to our hospital needs. We're literally going to make sure, as I said, that as we see cases rising, that we're meeting the needs in hospitals around America to stand up the response that any one of us would want a family member to be able to have access to. Then we've asked Dr. Fauci to give us an update on the incredible and historic progress on the development of vaccines. It seems like with good news happening every couple of days, that's a great encouragement to the American people. And then General Gus Perna will outline our distribution plans on Operation Warp Speed. I was at FEMA today, received a detailed briefing about our distribution plans, and here today to make that presentation to the American people. And it is in a very real sense putting us in a position that literally the day after one of these vaccines is approved, we'll be shipping vaccines to the American people, and within a day after that, we'll be seeing those vaccines injected into Americans, with a particular focus on those most vulnerable and those that are providing health care to the American people. Finally, we'll talk with a bit about the way forward as state and local governments are continuing to act and take mitigation measures to slow the spread. You can assure them, as we did governors again this week, that we'll support decision-making at the local level. And we'll continue to support decisions that are made in each individual community based on the circumstances on the ground. But that being said, President Trump wanted me to make it clear that our task force, this administration, and our president does not support another national lockdown. And we do not support closing schools. You'll hear from Dr. Robert Redfield of the CDC that actually the CDC never recommended that we close schools at any point this year. And Dr. Eleanor McCants-Katz, who is also serves with substance abuse and mental health services at HHS, will describe the real costs to children being away from school. But in every one of these cases, we're going to give you the best information that we have up to this moment. And I just want to assure the American people, as I trust that you will have a sense today, that we're going to continue to work around the clock to meet this moment. But help is on the way. We have every confidence that in a short period of time, we could have one or more safe and effective vaccines for the American people. And as each of us does our part, in partnership with state and local officials, each of us does our part to look after our own families and our own communities. I believe the day is coming soon when we will put this coronavirus in the past. With that, let me introduce Dr. Deborah Birx, who will update us on cases. General Carter, thank you. And as he said, from the time President Trump announced Operation Warp Speed, General Perna and his team have been working literally around the clock to build the distribution plan that you see that's in effect. And I hope you all heard that. I asked him how many of those kits have already been manufactured for merging with the Moderna product, and they've already assembled 100 million kits that are ready to go, and that's the supplies that are necessary for administering the vaccine. I must tell you, having received my latest briefing today over at FEMA from Operation Warp Speed, I think every American can be proud of the fact that we have a plan in place, that the moment that the FDA concludes that that vaccine is safe and effective, we have a system in place to begin within 24 hours shipping that vaccines to hospitals, healthcare facilities, and 24 hours after that, literally injecting that vaccine into Americans. And we'll also be continuing to develop the prioritization, working with states about their plans, and maybe Bob Redfield of CDC will reflect on that as well in a moment. CDC will create a recommendation for priorities of who's to be immunized, but if history is a teacher, we know that we'll focus on those most vulnerable, we'll focus on our healthcare workers and first responders at the early going. But it's truly inspiring to me to see the incredible work that Operation Warp Speed has done. And General Perna, I want to thank you for your dedication. With that, as I said, we've continued from the very beginning to operate an approach at the federal level that is federally supported, state managed, locally executed.
Look into executive branch misconduct, because you basically are giving
Biden team, how much contact has there actually been between?
When he asked me,
and all ranks.
your moving company found
Again, we're not calling for a national lockdown, and we won't. But beyond that, there have been some actions taken in jurisdictions around the country with regard to closing schools. I wanted the American people to know that It is the position of this task force, of this administration, and of the CDC that we do not need to close our schools. I want to invite Dr. Redfield to come forward to speak about that, but I want to emphasize what he's reminded our task force of many times, that actually at no point in this pandemic has the CDC ever recommended closing schools. And the more we've learned about this virus, the more it's simply affirmed that. We think our kids belong in the classroom. We're absolutely committed to continue to provide resources so our kids, our teachers, our administrators can safely get back to school. But with that, let me introduce Dr. Redfield, and with him, Dr. Eleanor McCants-Katz at HHS, who is an extraordinary leader. She's going to speak about the unintended consequences of shutting our kids out of the classroom around America. And then I'll have the Secretary have some closing remarks. Dr. Redfield? For sharing the news. And know that this team, working in cooperation with our states and with the cooperation of the American people, has made great progress. And we're getting there. We're getting there, America. And as I said at the outset, let me say I hope it's more in evidence as you hear from this team about the abundance of supplies that are available today for our hospitals, our ability to track what's happening at your local hospital to make sure that it has the PPE and the equipment and supplies to provide the health care that your family may need. I hope as you heard about the extraordinary distribution plans of Operation Warp Speed and the confidence that Dr. Fauci expressed today, and the news that one of those research companies is going to submit an emergency use authorization tomorrow on the very first vaccine, that we are literally, we could well be just a matter of a few short weeks away from a vaccine being available across this country for the most vulnerable among us and for those that are caring for them in our hospitals and our clinics. I hope everything you've heard today gives evidence of what I said at the start, that America has never been more prepared to combat this virus. But let me be clear as I close, we all have a role to play in the days ahead. And you heard this team say, as we see that finish line, as we see light at the end of the tunnel, as President Trump often says, and you should see evidence here that we are rounding the corner to that day that we have a vaccine for the American people. We do want to encourage every American to continue to do your part. Wash your hands, practice social distancing, wear a mask when social distancing isn't possible. Do your part to put the health of your family, the health of your neighbors, the health of the people in your community first. We are all in this together. And as I've said many times from this podium over many, many months, I know that with the cooperation of the American people, with our incredible doctors and nurses and first responders, with the extraordinary partnership of federal and state and local health officials, we will get through this. And we will get through this together.
Mr. Vice President,
Thank you all.
Mr. Vice President.